Okay, good afternoon, everybody. Welcome to our final Office of Public Policy Events Diverse Perspectives Series panel of the fall semester, Abortion in America, Civil Dialogue Across the Divide. I'm Nick Seabrook, Professor of Political Science and Director of Public Policy Events here at UNF. And this event, as I said, is part of our Diverse Perspectives series, which promotes open discussion and debate of contested public policy issues from diverse perspectives, facilitates community engagement, intellectual discourse, and the advancement of knowledge, and furthers our core principles of civil discourse and the free exchange of ideas on campus. 3 years ago, we experienced the most significant and seismic shift in abortion policy in the United States since Roe v. Wade was first decided back in 1973. In the case of Dobbs versus Jackson Women's Health Organization, the U.S. Supreme Court ruled by a 6-3 vote that the Due Process Clause of the 14th Amendment to the Constitution does not protect a woman's right to a pre-viability elective termination of a pregnancy. This brought to an end an almost 50-year period during which Roe had established abortion rights as the law of the land. 2 years later, in the case of Planned Parenthood versus State of Florida, the Florida Supreme Court similarly overturned a 1989 decision that had held that abortion rights were also protected under the state constitution, allowing the legislature's recently passed 6-week abortion ban to go into effect. As the Florida example illustrates, the returning of this public policy question to the states has had immediate and significant effects on abortion access. State legislatures have passed laws either banning or significantly curtailing elective abortions, or else affirmatively codifying abortion rights into state law. State Supreme Courts have wrestled with the question of whether their individual state constitutions protect a right similar to that which the Supreme Court had previously held in cases like Roe and Casey. And voters themselves have had the opportunity to weigh in, heading to the polls to vote on numerous state ballot initiatives related to abortion policy. As of November 2025, abortion remains broadly legal in 31 states, while 19 have imposed restrictions that would have been impermissible under the legal framework established in Roe and Casey. This includes 12 states where abortion is prohibited entirely, with limited exceptions, and 7, including here in Florida, where it is prohibited after 6, 12, or occasionally 18 weeks. At the same time, efforts to enact either a national codification of Roe or a national abortion ban have repeatedly stalled in Congress over the last 3 years, under both Republican and Democratic control. And during the 2024 campaign, President Trump promised to veto a national abortion ban if one were to make it to his desk, declaring that it's up to the states to decide based on the will of their voters. That then is the situation, the playing field we find ourselves on when it comes to the debate over abortion policy in the United States. And here to discuss this pressing public policy issue with me today are 2 members of the abortion policy advocacy community here in the state of Florida. Together, they represent diverse and opposing perspectives and approaches to this area of public policy. Linda Bell is the president of Florida Right to Life, a nonprofit, nonpartisan, grassroots public service organization dedicated to protecting and fostering pro-life values across all areas of public policy and society. She has also served as a member of the governing board of the Florida Communities Trust, as an elected Miami-Dade County Commissioner, and as the first, and to date only, female mayor of the city of Homestead, Florida. Also joining today is Sarah Parker, Sarah is the co-founder, executive director, and president of Voices of Florida, a Black and queer-led nonprofit, nonpartisan grassroots organization dedicated to defending human rights, civil liberties, and reproductive freedom. She is also the co-founder of Occupy Florida, a member of the Floridians Protecting Freedom Coalition, and in 2024 was elected to a 4-year term as state committee woman for the Sarasota County Democratic Party. And I want to begin by going back to the Supreme Court decision that has kind of made the focus of today's event and has really shifted the landscape when it comes to this public policy debate in the United States. And I want to ask both of our panelists, as people who are actively involved in advocacy in this area, how do you see the Dobbs decision as changing the balance of power between federal government and the states when it comes to abortion policy? And to what extent has Dobbs changed the way that you yourselves approach abortion advocacy in your organizations?
Do you want to go first when I go? Well, first of all, I just want to say thank you. Thank you to the university for having us here. I really appreciate it. I don't think I've been on a college campus in many, many years. And so it's kind of really cool to be here. I appreciate that. I appreciate the open dialogue. So the decision 3 years ago in June said that basically, the Supreme Court decision that legalized abortion within all 50 states was ruled as unconstitutional. And what it said was that there's nothing in the Constitution that guarantees a right to have an abortion. There's nothing in the Constitution that says that. So the decision 50 years ago was what you would call an extra-constitutional decision, more of a political decision. And what it said is, in the absence of a constitutional saying, or something that's solidified within the Constitution of the United States that guarantees a right to an abortion, that then it goes to the states. And so it never outlawed anything. It never said that the one abortion was going to be outlawed. What it said was that the decision must be returned to the states, rightfully to the states where it was. And so that's what happened. And I think in the very beginning, I expected to have a lot of outrage, and it wasn't a lot, as much as I expected. But what it simply did is it allowed the states to say, let's take a look. Each state, each 50 of the 50 states has its own legislature, and they could decide within themselves whether I like that or not, whether I think that California has gone way, way too extreme, and they think Florida has gone too conservative. That's what the state allows. And that's the freedom of the state, the freedom to elect the people that represent you. And represent you and your values. So I think it was a very, very right decision. It was a correct decision. And even Ruth Bader Ginsburg never liked Roe. She said she never liked Roe. She never liked the premise of Roe. And she said that what Roe did is it really didn't empower women, it empowered the abortionists themselves. And so she was never comfortable. She was pro-abortion, but she was not comfortable with Roe, thinking that all this time that Roe was wrongly decided. Many people on the left knew that Roe versus Wade was on very thin ground, very, very thin constitutional grounds, and likely understood that it would one day be overturned. And so that's where we are today. So Florida, since that time, has enacted a 6-week heartbeat bill that allows abortions up into 6 weeks, with exceptions of rape, incest, life of the mother, medical issues with the female, and human trafficking. Those are the exceptions, which are many, that allow for abortion in the state of Florida up through 6 weeks. Thank you.
Sarah.
Thank you, Linda. So yeah, guys, I've also sat on the executive committee of Yes on 4. I think that's really important. When we think about, I remember when the Dobbs decision came down, and we were part of one of the first groups to march at the Supreme Court Justices' houses. We flew up there pretty immediately. I think it's important to, I'm really big into history, right? Going all the way back to medieval history, love Anne Boleyn and the Tudors, to the civil rights, because the civil rights movement was what impacted me the most. During that time, we heard a lot about state rights, right? And had the federal government allowed states to have their rights, it would have caused jurisdictional inequality. And that's what we're seeing after the fall of Roe. We're seeing jurisdictional inequality, meaning that it depends on where you live, your rights. And I believe that personal liberty and autonomy are important. This also created a patchwork of laws, right? And that means in different places, it causes confusion and chaos, which creates more barriers. Even when we think about the legislator, we know during Amendment 4, we got 57% of the vote. I understand that that was not the threshold for the 60%, but 57% means that we got the majority. The majority of people in Florida wanted to end the 6-week abortion ban. But I want to add to that Donald Trump got less of a percentage. What people thought was happening was that the Democrats would win with abortion on the ballot. No, because we knew that Republicans were also going to vote to end this abortion ban. So we expect the legislator to do what's right. That becomes problematic because we're even seeing that right now in this moment, that they're not doing what their constituents want. They do not care about what their constituents, because it was very clear. With that, I think that it comes down to the states being gatekeepers of personal liberty. That is also problematic. I would hate to see our civil rights rolled back. And I think that this sets a very dangerous precedent to roll back our rights. And another thing that I think is incredibly important is that no matter what you believe, when we elect people, we elect them to listen to us. We elect them to vote how we want them to vote. And we're seeing that they don't actually do that. And even when it comes down to direct democracy, we're seeing that Florida continuously puts up barriers for our voices to be heard, continuously shows us that they believe that their constituents are either too dumb to be able to understand something, or that they don't believe that they should have to follow what you say. So when it comes down to the Dobbs decision, I think it brings a lot to think about. I don't think there's a yes, no, right, or wrong answer to that. But for me, it brings about a lot to think about.
I'd like to address some of those comments.
Sure, and both of you feel free to respond to each other, and if you would like to do so as we kind of go through our discussion.
Yeah, I'd like to address some of those comments. So I worked with against Amendment 4. So Florida Right to Life saw that there needed to be another effort besides what the effort was currently. So we formed Do No Harm Florida. We helped form Do No Harm Florida, and I was on the committee with Do No Harm Florida. We worked very, very hard to inform. What the 57% threshold showed was that the money flowed in from all over the country to support abortion. All over the country. They were getting $1 million here, $10 million here from outside of the state of Florida. So the outside of state of Florida financial influence was huge and heavy. The last time I checked, the yes group that wanted abortion extended all the way through birth was heavily influenced. So that 57% was because of $110 million spent on a lie. And so every time I saw a commercial, my mouth would just fall open, because it would be something like, you can't have an abortion in Florida if you're going to die. False. You can't have an abortion in Florida if your daughter is raped. I even saw a commercial of a Coral Gables, I think it was a physician, walking his daughter. If my daughter was raped, she would be forced to carry the baby to term. That was a lie. So every time we kept seeing lie after lie. If she has an ectopic pregnancy, she will not be treated. If she's hemorrhaging, she'll die in a hospital. All of that is a lie. Florida has one of the most generous, if you will, exceptions policies with rape, incest, life of the mother, medical emergencies, fetal anomalies, and even human trafficking. So all of the exceptions were there. You would have never known that had you watched any of the advertisements and the commercials. So the 57% was a really good example of what money can buy. We all know that money can buy a lot of lies. And it's one of those, to me, it was one of those experiences where the lie goes halfway around the world before truth gets to the end of the block. And so we were fighting very, very hard to try to bring the truth to people. And when people realized, do you realize that this amendment could actually do away with parental consent? We were told that's not true. But when you looked at the language, absolutely it could have done away with parental consent. It could have done away with all of the protections that have been built in to protect girls. Parental consent, parental notification, women's right to know what happens in an abortion, thrown out the window. Every single piece of legislation that we work to protect protect women, to protect girls, would have been tossed and thrown out the window. That is not rights. That is taking away the rights. That's taking away the rights of mothers, taking away the rights of families to protect their own children. I was appalled that they would go that far on yes on 3 and yes on 4 to say, this is okay, because it's not okay. And those limitations that were placed on this legislation were so reasonable. So when we talk about personal liberty and autonomy, oh, by the way, I'm so glad that Florida did pass a 60% threshold to change the Constitution, because any board that you sit on, anytime that you change your Constitution or your bylaws, you always need a 2/3 majority or even more of a majority to change your Constitution, because your Constitution is a document that should not be easily changed or manipulated. And so we saw how easy it was by the pregnant pigs. I know some of you might be too young to remember this, but years ago, there was an activist group that said, how we treat pigs is cruel. And so it was the Pregnant Pigs Amendment. You should look this up. And so the pregnant means basically it banned pig farming in the state of Florida. It passed. So all pig farming went out of Florida and went out of state because of that. So when they saw, and it was based on a bunch of falsehoods as well, so that's when it went on the ballot and the voters selected the 60% threshold, the people of Florida. And also say that our representatives don't represent us, even with the 50% threshold, with 110 million, at least 110 million spent on lies, we see that now still 50% of Floridians are still pro-life. 50% of Floridians still think there should be some reasonable limitations to abortion. And even more, upwards of over 70%, believe that parents should have a right to know with what's happening with their little girls, their minor girls. And so with this kind of liberal abortion laws that you're seeing happening in states like New York and California, where you can literally have an abortion up until the time the baby is born, when you're seeing that, that doesn't offer protections to women. That doesn't offer dignity. That doesn't offer civil rights. It does it's very counterproductive to that. Thank you.
Can I go ahead? No, I don't want to do a back and forth, so I'm just going to do this last time.
Oh, go.
Thank you. So I know that my colleague here talked about exceptions, but let's get down to it, because I'm here for real stories. Anya Cook found out she was pregnant, and she bled out in a salon bathroom floor after going to the hospital to try to get help. She lost half of the blood in her body. We look at Deborah Dorbert. I got to actually meet Deborah Dorbert, and she is one of the sweetest ladies I've ever met in my life, and she fought like hell for the baby that she wanted, the baby that she named, the baby that she decided what color her nursery is. As a mother, her telling me that story one-on-one destroyed me. I think when we talk about late-term abortions or any of those buzzwords, we don't think about those actual women that wanted to bring that baby home. Deborah Dorbert was one of them. She found out, I believe she was 24 weeks, that her baby would not make it. And instead of being able to have access to an abortion, she had to birth her child. And when she birthed the baby suffocated, gurgled. Okay, that's what she used. She was gurgled in her arms. That destroyed her and ripped her apart. We know that these exceptions are too ambiguous. We have seen that even with Congressman Kat, I think her name is Kat Kamak. She almost didn't get the access she needed because of ectopic pregnancies. Like, I think that's incredibly important. And then we look at the rape, right? The police reports. How long does it take for someone to get a police report? It does not happen overnight. This could be months, this could be weeks, this could be years. And then it's also, as someone that is a survivor of sexual violence, it's a matter of, am I gonna go report that? Am I going to put myself in more danger? As someone that didn't have really great parents, 9 times out of 10, if I would have went when my stepdad was abusing me and I would have went or had to get parental notification if I chose to have an abortion, that would have caused more abuse in my home, be it to me or my mother. We have to look at this as real life solutions, right? We have to have real life solutions. We know that it's not a one size fits all. These exceptions are not real exceptions, and I stand by that. The police report thing is laughable because we have to understand that these are victims of sexual violence. And until you are a victim of sexual violence, it is hard for me to be able to relate or find common ground with that. Until you have to go make that report, until you have to relive that trauma, it is hard for me to say that you think that I should not have control over my body when the control over my body was taken the moment I was sexually assaulted.
I'd like to respond to that as well.
No, that's fine. I mean,
Thank you.
The students are here to listen to you.
This is good. This is very good. So I can give you names too. I can give you the names of women who were beaten to death for refusing to have an abortion, whose boyfriend said, you'll either have an abortion or you'll die, or you're going to have an abortion. Or how about the little girl, young girl, who was slipped the abortion drugs, mifepristone, misoprostol, into her drink so that she was aborted the baby that she wanted because it was readily available. One of them was a boyfriend, another one was a mother who ordered the drugs by mail and gave them to an unwilling and unwantedly to a child or a young woman who wanted to have that baby. Now let's go back to these rare cases that was just talked about earlier. Yes, in those cases where women are having really serious problems within their pregnancy, it is the law that they be treated. It is the law that they be cared for in a hospital, in an emergency room. And I believe what you're referring to was after the 15-week bill, not the 6-week bill.
Yes.
Because that happened pre-6 weeks. So to say that that is the 6-week bill is false. Now, the 15-week bill, there was, when this first passed and stuff like, situations like this occurred, those emergency rooms were obligated to care. When a woman walks in the door, that mom walks in that door, they're obligated to care for her as the patient first, and then for the unborn child second. The mom is first. So to use these types of cases to justify abortion through birth, late-term abortion, to justify this is just absurd. These rare cases will happen. But by the way, at 24 weeks, they could have done it. If that baby wasn't in distress and the mom was in distress, they could have done a very fast C-section, removed the baby immediately and cared for that mom. I have a niece who hemorrhaged, and she was with a midwife actually, and there is care. She was obligated to care for my niece first, the patient first. And so to use these exceptions as an excuse to have abortion through all 9 months of pregnancy, or to excuse away late-term abortions, should just not be allowed. Also, when you say these names, you mentioned ectopic pregnancies. This is a problem because ectopic pregnancies are a real thing. Well, getting mifepristone, misoprostol, the abortion drug, the chemical abortion cocktail, through the mail, which is what the pro-aborts want as well. They want a no physician requirement, a no in-person requirement. You don't know what the medical background of that young woman, that mother coming into that facility, you don't know what could be going on within her body. If she gets those abortion drugs through the mail and she has an ectopic pregnancy, or there's some type of negative RH factor that nobody knows about because she can just get them through the mail, she could die. So it's the opposite. It's the converse of what's being argued. If we really care about women, we care about their babies, we really care about what's happening with the lives of these women, we need to do everything to give them the right information and protect them, not to just say abortion at all costs. Now let me deal with the police reporting. Rape, I can't even imagine the trauma. It's got to be the most horrendous thing. I've had women share with me their experiences. I've had women that gave life after it, and I've had women that had abortions after, following their rape. Here's the problem. If you don't report that violence, that offender is free to go on and violate other women. That person's free to go on and molest and rape, and if it's a case of incest and you don't report it, and then it's not reported to the authorities, that person is free to offend against the girl over and over and over again. So we should be embracing reporting as a way to protect all women and all girls, especially into the future. So it boggles my mind. I sit in the Florida legislature every single year listening to all of these arguments against good pro-life legislation. I listen to the arguments against parental consent. I listen to the arguments where the pro-aborts didn't want parents to even know that their girls were pregnant, with that very same argument. It could be violence. Well, if there's violence in the home, then arrest that parent. If there's violence in the home, fix the solution. Don't abort the child and send him back into the home of the abuser. That makes absolutely no sense. If we truly want to protect girls, if we truly want to protect women, we would embrace reporting so that we could take that abuser off the market for good. Thank you.
Well, thank you both for your insights and thoughts on those elements of public policy here. To kind of shift focus slightly, perhaps, many of you may have attended our recent event where we looked at healthcare policy and the question of whether healthcare was a human right. And we tried to distinguish in that event between kind of higher level philosophical or constitutional questions. Does the liberty provision of the Due Process Clause of the 14th Amendment to the Constitution protect the right to an abortion, and under what circumstances, is kind of inherently a philosophical question rather than a practical question. But I'd like to think about perhaps some of the kind of lower level details or practical details of this debate. And you've addressed some of these in your responses so far. But fundamentally, when the issue of abortion is returned to the states, where states have the opportunities to craft their own legislative solutions and their own policies in this area, some states prohibiting or restricting, some states expanding access, ultimately, those laws are affecting and directly regulating both individuals and healthcare providers as well. And so I wanted to get both of your perspectives of how this kind of patchwork of state laws, how that affects decisions that individuals might make, how it affects the behavior of healthcare providers, and how ambiguity might also factor into some of those debates as well. Why don't we begin with Sarah?
So I think that for a quick, short answer, it creates confusion and chaos, right? I think that, my colleague just mentioned about MIFI and MISO and how you can get that in the mail, right? But right now, the only way for people to get access and understand the information that's given to them, understand their bodies, understand what abortion is by going to PlanCpills.org. That's where they're getting their information from. And if we didn't have those barriers set up and we didn't have those causing chaos, they could go and get clinician-assisted abortions. OBGYNs are leaving the state. They're leaving the state. We already had a shortage of OBGYNs, and that's not only problematic because of abortion rights. I want to be clear, reproductive health and reproductive rights, which is what I stand for, isn't just about abortion. It's about what happens after the pregnancy. It's about making sure that people have access to the things they need to take care of a child. It's about the Black maternal mortality rate. And oftentimes we get confused when we just think about repro and abortion, or we just think about abortion and coincide that with repro. If people actually did care, we wouldn't be up here having a conversation about abortion. We'd be up here having a conversation about the Black maternal mortality rate, that Black women are 3 times more likely to die during pregnancy and 8 times more likely in places in Florida. So when we have OBGYNs leaving the state, meaning that most people that probably are on Medicaid also have a lack of care, that is problematic. That is scary. And it is impacting not just the abortion landscape, it is impacting everyone with the capacity to get pregnant.
Interesting, because I hear this data and these statistics about OBGYNs leaving the state. That's not true. That is not true. I hear statistics about maternal mortality rates. What's interesting is Texas has almost a total ban of abortion besides life of the mother. The maternal mortality rate has not gone up, not 1%, not 1%. That's not, it's just false. It's just false data. I also heard that what's really sad to me is that in New York, especially in New York City, more Black women are having abortions that are delivering babies. That's a crime. That's a crisis against the Black community. Why are abortion clinics put up in poor and Black communities? because Margaret Sanger, the original founder of Planned Parenthood, was the biggest racist and eugenist there ever was. And she wanted to actually use the elimination of the poverty class and the elimination of the black class as part of it. Look her up. Look up the roots of Planned Parenthood and you'll see it. I'm actually friends with a woman who did a wonderful book on Margaret Sanger and her life. And you'll see that she was very Hitler-esque in her attitudes towards eugenics. And the fact that we use Planned Parenthood as this paradigm of reproductive freedom is just boggles my mind, because we should be fighting for the rights of black babies to live. We should be fighting for these women. And what's also ironic is that we in the pro-life community have homes. We have maternity homes. We have pregnancy centers, crisis pregnancy centers all over the state of Florida. Guess what? Our services are free. Pregnancy centers don't charge for their services. There's a beautiful home right now in Naples that takes in women who are facing these unplanned pregnancies. And by the way, I would just like to say, there's no such thing as an unwanted baby. There are definitely unwanted pregnancies, or let's just say surprise pregnancies, but there's no such thing as an unwanted baby. In this country right now, we have twice as many families, couples, people that want to adopt children than we have children available because of abortion. It's because when children become disposable, and when children are throwaway and become disposable, we don't have babies, except for, in fact, a good friend of mine has adopted 4 children from the foster care system. And it is the pro-lifers who are out there adopting these children. It is the pro-lifers that are putting money and giving. In fact, just to give a little plug, we're having a gala here in Jacksonville in January to raise money for the Right to Life community, for these babies. And so we put our money where our mouth is. As president of Florida Right to Life, I don't work for a salary, I work without a salary. Most in the pro-abortion community don't do that. When you go to any kind of a clinic, everything costs. There is a fee for that. If you go to a pro-life pregnancy center, nothing costs. The services are free and they're there to help you. So to say that we need abortion, we have to have abortion, to use the excuse of maternal mortality, it's just inexcusable. So I hear these lies over and over and over again, and I want to know where this data is coming from. It's manipulation of data. Take a look at Texas. When you have almost no abortions anymore, you have 0 increase in maternal mortality. That's a fact. That's a fact.
Yeah, I would like to respond. I went to a pregnancy crisis center when I first found out I was pregnant. I went there and they didn't tell me anything about what was wrong with my son, who I would later have one of the most traumatic pregnancies I've ever had in my life. They did pray for me, even though I didn't ask for it. They did tell me that it was a great viable pregnancy, even though when I went to the hospital, I bled out and when they were doing it in utero ultrasound. That did happen. So oftentimes I think about the pregnancy centers and I wonder, how would someone like me get care? And I think that it's important for us pro-abortionists to take a note that we should be offering free pregnancy tests. We should be giving out information. We should be making sure that they have diapers and formula. We should be doing that with no strings attached, not with prayer, not with an obligation to go to classes that have religion engraved in it. Another thing is, one of my friends tried to go before she moved in with me. She was a struggling drug addict. She's probably one of the best moms I know now. She was turned away from one of these maternity homes in Sarasota. It's not all rainbows and sunshine. And if we really want to get into Margaret Sanger, this country's built on eugenics. Let's be real clear. The way the black women have been treated, the speculum. You know who they tested that out on? Black women. They were the first test subject of that. And that was extremely painful with no painkillers. If we look at the country, generally black women are last thing to be talked about. And I wasn't talking about, because they don't have access to abortion, the maternal mortality rate is high. I'm saying that we spend so much time having these conversations, and if anyone was pro-life, that would be the center of the conversation. How do we make sure that black women have access to the care that they need? How do we make sure that black women can feed their children? How do we make sure that black women and black children have education, sexual education, comprehensive sexual education, one thing that Florida does not have? All of those things are problematic. I often sit across the table from multiple people that believe different things because I believe in two things. One, I'm not playing checkers, I'm playing chess, so I should know what my opposition thinks. But two, is trying to find a common ground to really understand what they think. As someone that was raised in a population of 300 in the middle of Georgia, Garfield, Georgia, I was raised vehemently anti-abortion. The first thing I ever heard about Planned Parenthood was exactly that, right? That they're putting it in black communities and black neighborhoods. But what no one told me is that they're also offering OBGYN specialists there. They're also offering to make sure that women get breast exams there. They're also offering STD testing and STI testing. They're offering comprehensive care. People want to focus on the fact that it's abortion. It's not just that. Reproductive health care is all of these things, and we need to know that. We need to understand that. These aren't just talking points. I know that when I went to the hospital, my best friend had one of the same issues. She got better care than I got. I was told I was being dramatic. I was told that I was being loud. I was being obnoxious. Come to find out, someone didn't open a file folder. I had my son at 2 pounds and 5 ounces. I stayed in that NICU every single day for 50-something days. That was one of the hardest things. Now, if someone had forced me to carry that pregnancy and do that, my child wouldn't be half the child they are today, and I wouldn't be half the mother I am today. I made that decision because I knew what was right for my family. I sat down with my partner. I sat down with my doctor, and I made the decision to continue my pregnancy with my beloved son, and the same thing with my daughter. A decision like that should be personal. It should come between your doctor, your family, and your partner. That's what matters. And I think we forget that. We can get caught up in the data or our talking points or our buzzwords. I'm not even reading that anymore. It's the truth. If you want to have a child, you need to make that decision. That's not on anyone else to make that decision.
You know, I sit here and I hear these arguments, and it's always, I don't get it. Black women, black community, black community. I was raised by a single mother. I'm one of 6 kids. We're white and we were poor. And so I hear these arguments a lot. The black community, the white community, I live in Tallahassee. We all go to TMH or we all go to Capital, which is now, I think, HCA Medical Care. There is care, equal care across the board. I live in a very rural area out west. That's what you would consider a healthcare desert because, and it's very rural out when you talk about Liberty and Calhoun County. And so, healthcare is a whole nother topic. Healthcare is a whole nother issue. But some of these arguments, I'm sitting here, I'm a little confused. And when you say go to plancpills.org, you can go in the state of Florida right now to any abortionist and get the pills up to 6 weeks, except for these exceptions. Why do you need to go to plancpills.org? Why are you not having that physician check you out and make sure that you're healthy, that you don't have ectopic pregnancy, that you don't have any complications? Why would you encourage a plancpills.org website when you can go right into the abortionist and get the pills and be safer? See, this is what I don't understand. If we're talking about the safety of women and we're talking about the safety of girls. And there is always a story. There really is. And there's terrible stories and there's tragic stories. We can't, this is what the left always does. They take the most tragic story, they take the most extreme story, and they want to have, that might happen to 1 to 2 to 9 to 5% of people, and they want to enact legislation that overarches to 100% of people. So we can't be making policy based on those rare incidences or those incidences that can happen and do happen, but they don't happen like all the time like you would think when you hear about it in the news or when you hear people talk about it. Most pregnancies do result in very healthy, happy babies. So we can't sit up here and say it's all doom and gloom for babies. Pregnancy is not a disease. Babies are not a consequence of a disease or a sickness or a problem. Babies are wonderful. Babies are beautiful. And there are 2 million families right now in this country that would love to adopt a baby. And there are about 1 million abortions every single year in this country that are needless abortions. So let's stop using these rare exceptions, these anomalies that happened to justify 100% of the abortions when they happen 1 to 5% of the pregnancies. I hear this over and over and over again, and this is what the leftists do. They use those rare exceptions to shove abortion and abortion policy down the throats of 100% of Americans or 100% of Floridians. I also want to go back to a comment that was stated earlier that our representatives don't represent us, that they think we're stupid. They do not. They do not. I sit there in the Florida legislature. Many of them are very in tune to what their constituents want of them. They're getting elected. They're predominantly pro-life. We have a supermajority in the Florida House and a supermajority in the Florida Senate. They were elected by the people, by the Republic. That's the democratic process. And those people are representing us, and they are voting the way we are asking them to vote. That's why they're there. If they weren't voting the way we would want them to vote, they would be unelected. That's the way the process works. Thank you.
Yeah, I just want to really quick respond. I said people are going to get more information at plancpills.org. I did not say that people need to go there to get or access abortion care. I said more, yes, thank you. I said more information at plancpills.org.
You can get it right from, you can go right to the clinic and get it too.
Yeah, I'm saying, but you want more information, something that's easily accessible, because we think about even since January, we used to have reproductiveaccesshealth.org or .gov. That's gone now, and that's where a lot of people would get their information since Trump's taken office. So if people need information, that's also a site. You don't just go on there and immediately it's asking you to, hey, would you like to buy some abortion pills? There's actual information on there, which no problem.
But they should tell the truth when they get those pills. They should tell the truth about how painful they are. They should tell the truth about the bleeding and the pain, because I know many girls/women have come to me and said they told me it would just be some cramping. I would feel some cramping and it would be some pain. And she said, I was in agony. I was on the floor. I was on the floor of the bathroom. I was crying. It was one of the most painful things I've ever been through in my entire life. They weren't told that. We need to be telling women the truth. We need to be telling girls the truth. It's not just going to be like, some cramping. And that's exactly what she told me. And also Planned Parenthood. Planned Parenthood is in the abortion business. It's not in the healthcare business. What it does, and it's a multi-billion dollar organization. Have you seen the latest Planned Parenthood report on how much money they make? They make billions of dollars, and they're in the abortion. This is the abortion industry. This is not the healthcare industry. Let's just be honest and real about this. Planned Parenthood is not in the business of healthcare. They're not in the business of palpitating your breast to see if you have breast cancer. No, they're not. They're in the business of abortion. Let's be honest.
All right, is it okay if I respond now? I just want to make sure you're done. Cool.
Oh, I'm so sorry. You're absolutely right.
You're good, you're good. I was going to let you run it out. It's fine. I don't know, last time I went to Planned Parenthood, I got a mammogram for one of the first times, and I got tested.
You had a mammogram at Planned Parenthood?
I'm sorry, my breast exam. I said breast exam.
Okay,
my bad.
thank you.
Yes, it's okay. I had a breast exam for one of the first times I ever had in my life. I didn't know that I needed one because comprehensive sex ed in the South, not real, right? So all the other things that you said, those again, like, first off, you said black woman, black woman, black woman. I'm only here to talk about my experience, and my experiences as a black woman. I also often hear about white women and what white men believe on a regular basis. I also grew up poor. My friends grew up poor. I grew up in the rural South. I understand, and I understand that some things that you might have experienced as a young child, I probably experienced as a young child growing up in the rural South, right? Like Walmart's an hour away. How do we get tampons or pads at the time, right? So I totally get that. But I'm here to talk about my experience. I think there are real conversations that happen when you are able to access a provider. I think the fact that the 6-week ban causes a lot of confusion. A lot of people do not know, and then you have to have 2 appointments in 24 hours. You're not able to access an appointment half of the time. I have seen people that have struggled to get access to an appointment. The rest of that is just, it's buzzwords and talking points, and I don't want to get wrapped up because we have a lot of other things to talk about. And the information's readily available for all of you. And that's why I'm here right now. I'm here to push back against misinformation, disinformation. One thing people can say about me, they can say that I'm loud, they can say I'm obnoxious, but I'm not a liar.
So both of you are actively involved in state-level abortion advocacy and trying to change state policy here in Florida. And I think if there's one overarching theme to public policy debate in this area since the Dobbs decision, it's been this idea of returning the issue to the states. We heard and saw the Supreme Court make that point in their opinion. We've seen President Trump make that point repeatedly when he's discussed the issue of abortion. And so I'm curious what each of your perspectives are on the prospect of potential federal legislation in this area, whether it's, Sarah, whether you support a federal law that would codify Roe or something similar, or Linda, whether you would support a federal ban on abortion that would apply to the entire country. We've talked a lot about federalism. We've talked a lot about individual states having the ability to make choices based on what their citizens believe. And so I'm interested in your perspectives on whether you think there should be federal legislation on this, and if so, what you think that should look like.
Okay, thanks. So, no, because the Supreme Court has already spoken. If they said there is no constitutional authority, there's no authority within the Constitution of the United States on how it's the actual document that says there's a right to abortion, then it was returned to the states. It should stay with the states, because they're saying that this is definitely the state's issue. And what kind of legislation would you like to be codified on a federal level when it's already been deemed by the United States Supreme Court that this is a state's level issue? And so it will be. And what you're seeing right now, and by the way, immediately after the overturning of Roe, there was people were very unsure. I agree with you, there was confusion. Like, where do we go from here? What do we do? Where do we go? And then a lot of people realized, oh, not a lot has changed. Not a lot has changed within the state that I live in. Not a lot has changed. In Florida, we went from 15 weeks to 6 weeks to protect babies. And so in states like Texas, they already had a lot of laws on the books. And so you have seen some states, but not a lot has changed when you have, I think, 32 states that still pretty much are the same. So what's happening is you're seeing within the legislatures, you're seeing a reflection of the voters and how the will of the voter within that particular state, within that particular legislature. Whether I like it or not, whether I like California's laws, whether I like the laws in New York or Maine, it doesn't matter. What matters is, now, I'm pro-life. I want to see babies protected. I want to see babies' lives saved. I want to see women not harmed. Want to see women not grieving and depressed over their abortion decision that they thought was going to be a breeze, and it wasn't. I want to protect all of them. So if I was to ever want federal legislation, it would certainly be to inform women on the effects of abortion, on the effects on their bodies, on the effects on their psyches. I would love to have that. But I doubt that you're going to see anything like that, because the Supreme Court already said this is the law. When there's extra constitutional or nothing in the Constitution, it needs to remain within the states.
So
Thank
just
you.
to clarify, you would support a federal law that was kind of requiring additional information to be provided, but you wouldn't support a federal law that banned abortion across.
Because it won't be constitutional.
Okay.
Because it won't be constitutional, because the Constitution doesn't say there's a right to have an abortion. It's not in the Constitution of the United States of America. So I'm pro-life. I would love to see all babies saved, but is that a reality right now? Unfortunately, it's not. But yeah, I mean, if I could wave my magic wand and save the babies, I would.
Thank you, Sarah.
Yeah, so
And the mamas.
I think that I care about people having access to reproductive health care. Period, point blank. How we get that done is how we get that done. I think that it's kind of contradictory, because when Roe versus Wade was still here and the Dobbs decision hadn't happened, it was unconstitutional for people not to have access to health care. Now they pulled it back. We're seeing a lot of different things happen during this administration that we're probably going to see redone, right? In the next 4 to 8 to 10 to 12 years. My biggest concern is that people have access to reproductive health care. How we get that, I don't care, but it's also to save women and also to save babies.
Reproductive health care is an interesting term, because everybody in this room has the right to reproduce all they want. But when you say the term reproductive health care, you mean abortion. Reproductive health care, that's the code word for abortion. Because you can reproduce all day long. If you want to go to it and reproduce. But you know what I want to talk about really quickly here? This is 2025. We are still using old arguments that I heard back in the 1970s. 2025. A pregnancy test at the Dollar Tree is $1.25. You can get condoms everywhere. I go to the North Florida Fairgrounds for the Florida Fair, and there's a Department of Health table with free condoms. You can get it. You can have access to all the reproductive health care when it comes to preventing pregnancies. I'm still shocked that we're still in 2025 talking about abortion when we have every single avenue to not get pregnant. You know when you've had unprotected sex. You know that. Wear the condoms. Use your birth control pills, whatever method of birth control. It's just that we're still using these same arguments. So I'm old. I'm a product of the 1970s. I just had my high school reunion of 50 years. So I just really dated myself. 50 years ago, I graduated high school. And I remember those same arguments because abortion was legalized in 1973. So it was every child a wanted child. We'd end child abuse. We would end poverty. No more poverty with abortion. No more unwanted children. No more child abuse because no children would be unwanted. Those same things. And then I go in the Florida legislature and I hear, poor women need abortion. Poor women need abortion. Poor black women need abortion. This is what I hear. How about we feed the women and feed the children instead of aborting their babies? Why don't we provide them care and love rather than aborting their children? This is 2025. Why are we still talking about abortion when there is almost free access to birth control everywhere? Why are we still talking about this? What we want is we want total freedom without responsibilities. These babies are not unwanted babies. They might be unplanned pregnancies, but they're not unwanted babies. There's somebody out there that wants that baby. Someone very, very close to me had an unplanned pregnancy when she was a teenager, and she gave her baby up for adoption. She met her a few years ago, and she's absolutely wonderful, has a beautiful life. My own daughter, my husband's sitting right there, was pregnant as a teenager. Our daughter became a client of a crisis pregnancy center and was treated beautifully. I'm sorry your experience wasn't the same. Ours was wonderful. She was provided everything that she possibly needed. I was given a phone call when I lived in Homestead that it was one of my husband's bosses who said someone in his office was pregnant, out of wedlock, and she needed stuff, or she was going to get an abortion. And I said, stuff? And the answer was, yeah. I said, what does she need? We'll get it for her. And he told me what she needed. She needed a crib, she needed this and that, so we got it for her. So the next day, everything was sitting, he told me where she lived, and everything was sitting on her front porch. We should never dispose of our children, our wonderful children, because of needs or stuff, or because of my job, or because I'm a college student. Pregnancy is not a disease. It ends in 9 months. You have a beautiful child. There's also adoption. There's so many wonderful things that we can do for our babies and for our bodies as women, besides letting somebody else take the life of our child.
Yeah, thank you for that. You know what, you're totally right when it comes to we should be able to, the babies and moms should have access to the things that they need. And what the Florida legislator should do is take that $30 million they're giving to unregulated pregnancy centers and give that back and stipend that out to all the moms, right? I think that's important because people can't afford to feed their kids right now. We're seeing that people can't even afford insurance on their households because of the Florida legislator. I think that's important as well. They could access Medicare to all, but they're not doing that. They're not doing that either. That's also important. All of these things are super important. So yes, I 100% agree with you. People have access to these things, probably abortion rates would go down. I'm here for that. Take that $30 million. That's $30 million. Take that and give that to mothers that are incoming, that are applying for Medicaid, and say, here, buy your kid a whole bunch of things that you need. Buy your house. Pay your rent off for 6 months, girl. Here you go. I think that would be extremely helpful. With that, I think that, yeah, sorry, I'm trying to like recenter myself. People, as a mother, I'm also sorry that my experience in the crisis pregnancy center went bad. I didn't know where to go. No one gave me access to that. I think reproductive health care or reproductive justice, right? That was coined by 4 Black women. Reproductive justice is access to period pads and tampons, which we do for a local high school that's marginalized in Manatee County and Sarasota County. Reproductive justice in healthcare is being able to take maternity leave, which is companies do not have to give you in the state of Florida. Reproductive healthcare is being able to make sure that your child can eat food. Reproductive healthcare and reproductive justice is making sure that your child has access to education so they don't wind up in a predicament in which they get caught in the welfare spiral and cycle. Reproductive healthcare and justice is intersectional with every single thing. Reproductive healthcare and justice, making sure that your lights don't get cut off. You don't have to choose between feeding your child or making sure you have light so that they can take a shower and or they can wash their clothes in hot water. Reproductive healthcare and justice isn't just a term for abortion. It's a term to be able to reproduce in a society that is healthy and safe for your child. Reproductive healthcare and justice is also your child not getting shot by the police. Reproductive health care is your child not getting hit by a car by the police, which happened in Sarasota County when a kid was out running around the street. Reproductive health care and justice is access to daycare. The ELC was just cut by the Florida legislator. That's what reproductive justice and reproductive health care is. I want to be clear. It's all intersectional to me. And as a mother, I want my daughter, who is 4, to be able to make the same decisions I made. And hopefully I'll be a grandmother like you one day. I want that. I want to be a great grandmother. I want to move in the middle of Georgia and have 10, 12, 15, 20 grandbabies running around and then sending them home whenever I'm done with them. I want that. But I want my daughter to make that decision for herself.
I'm glad you brought up the $30 million. So when the Florida legislature passed the bill, the 6-week bill, they also set aside $30 million per year to assist women, to help moms who need help, who need that care. So they put their money where their mouth was, because I'm sitting, like I told you, I'm there, I'm in the legislature, and I'm usually lobbying for these pro-life bills and against really bad bills. And I get really tired of hearing the term fake clinics. Pregnancy centers, or unregulated clinics, I think was the term. Pregnancy centers are nonprofit. They are not funded by the state. They're not funded by the federal government. They don't get all of those dollars. And when if they take any dollars, there's usually lots of strings attached. Some of the pregnancy centers are faith-based. Some of them are not. Different kinds of faiths, different kinds. Some of them are secular, some of them are faith-based. And they're there to help girls. They're here to help the moms who need help, who need care, who need things, who need parenting classes, who need job training, who need skills. They're there for a lot of things other than just saying it. And, you know, it's interesting to say they prayed for me, but they didn't do this, they didn't do that. Well, you can do a lot. We can multitask. We could pray for you, and we could provide for you as well. And I know the program in Naples is a 2-year program. But I'm so glad that you brought up the 30 million, because I kind of forgot about it. And that's money that's set aside every single year where the state of Florida put its proverbial money where its proverbial mouth is to help those moms who have needs, to help those moms who need things, who need stuff. And like I said, the same arguments, with all due respect, some of the very same arguments I heard, with a little bit of twist, a little bit of different caveat. The very same arguments I heard in the 1970s. Hunger, feeding, healthcare, abuse, same arguments. They might have a different dress on, but it's the same arguments. So 50 years later, 63 million dead babies, and we're still arguing the same cures. The same things are going to fix our problems didn't fix them 50 years ago. 63 million dead babies, and we still don't have the problems fixed because we've left a trail of broken hearts. We left a trail of not just dead babies, but broken mamas all over. I know this well. Nobody can refute that with me. I know this well. I know them well. I've sat with them and I've cried with them. I've sat with one girl in Ohio whose parents are suing now, was forced into an abortion by the boyfriend's father. A very, very influential man. He called her a slut and a whore and everything else for his son getting her pregnant. Took her to an abortion clinic, she had an abortion, she went upstairs, she committed suicide. Where's her life? Does her life mean anything? I have stories too. About how horrible, how abortion has destroyed the lives of so many women, so many girls who are told, just do this, just have this abortion, just take these pills, just do this and all your problems will be solved. You know, one of them said to me, I actually felt relieved for about 24 hours, for about 48 hours, I felt relieved. And then she said, then I got so depressed. And then I turned to drugs and alcohol and then sexual promiscuity. And there's something within, in the abortion psychology, where a lot of times when girls or women have an abortion and they feel so guilty about it and torn up about it, and a lot of them every single year around that time that child would have been born, they see a child who's 1 and they look at that child and they say, my child would have been 1, my child would have been 2. I know this very, very well. I know this from my own family, and I know this from people who have talked to me. We've done counseling. I know our church did a whole abortion recovery group, and there was about 12 women there who had abortion recovery, and they're actually healed. They're healed from their abortions. They're healed from the trauma, and they're healed from the grief. But this is real, people. This is a real thing. So again, I sit through these kinds of discussions with good people, good people who we just happen to disagree. But these are the very same arguments I heard in the 1970s. Abortion doesn't fix anything. It just exacerbates a problem. It exacerbates what is something that happened or a circumstance that they feel desperate or they feel lost. Let's love them. Let's love these women. Let's love these girls. Let's help them with their babies, not offer them a way to kill them.
Yeah, I'm going to respond, try to make it as quick as possible. Seems like we have a man problem. That's what I was going to say as a feminist, because no, absolutely not. Forcing someone to get an abortion is not okay. I don't agree with that. I think a woman and a person that has autonomy over their body should make that decision, 100%. I think that people should report their abusers. We mentioned that earlier, 100% you should report your abusers, but we should also have something set up so that we can take care of those people when they do report their abusers, right? I think that also I think you're right. We're both talking about extreme situations. Let's talk about non-extreme situations. There are people that it's not a hard decision for them to have an abortion. They don't go in there crying. They have the abortion, and then they continue the rest of their day and their week. That's just the reality of the situation. Me and you are both talking on extreme levels. There are just situations in which it doesn't impact them at all, because sometimes abortion isn't a hard decision. Sometimes it's an easy decision, and that's okay too. I think you're saying, the 70s talking points. I was born in the 90s, so I couldn't tell you about the 70s talking points.
Okay, quit bragging.
I'm also a Halloween baby, if I'm going to keep bragging. I'm a Scorpio. Happy birthday to me. So,
Belatedly.
Thank you. So, the 70s talking points, I think that if it's still true, why not keep saying it? Right? I don't think there's a one solution fixes all problem. I never believe that. I do think that there are 2 sides to the story, if not 3. That's what I tell my children. So I'll go talk to them and take my 4 and 6-year-old. They both tell me something happened, and then I utilize my mom brain to have that decision, right? That meeting ground of what really happened. And part of it's if it ain't broke, don't fix it, right? Growing up in the South, I'm not going to change my grandma's collard greens, even though I think she could probably put a little bit less salt in it. Right? I think that if you do talk in extremes, and if people are like, well, this will end child abuse, well, we know that that's not true, right? But will it lower it? Absolutely. If we're going to talk in extremes and say, this will end rape, we know that's not true. Rape has been a part of our society since the beginning of time, because we have a man problem. If we're going to say that this will take people out of poverty, no, that's not true, because there is a cycle in which perpetuates poverty, which is capitalism. I'm not a liar. So yeah, I see your point. But I also see that even though I, again, grew up anti-abortion, I was super anti-abortion. I had my own talking points growing up. My mom actually worked for an abortion hotline. And I'm here and I talk about what I believe. That's why you see me glance over there once in a while and then I stop, because the talking points don't matter. It's just the experience and what's really, what's factual. So yes, it's a yes and is what I like to say all the time when I'm talking to my team. It's always a yes and when anyone asks me something.
this is a great irony because I grew up pro-abortion. And so I heard the arguments. You grew up pro-life and I grew up pro-abortion. So I grew up in a fairly liberal household, and I realized that my mom she was just spouting the talking points that she heard, that, oh, every child will want a child. I mean, it was just a mantra. And so I grew up in the household that said that abortion was fine, it was okay, it was no big deal. We also at the time didn't have ultrasound. I'm really dating myself. We didn't have ultrasound. When abortion was legalized in 1973, January 22nd, 1973, there was no such thing as ultrasound. We did not have a window to the womb. We could not see that baby sucking her thumb. We could not see flipping flip-flops. We could not see that. We couldn't see, oh, well, look, there's twins in there. So we did not have all of that in order for me to be pro-abortion. As a matter of fact, when I was in school, I went to Nova High School in Fort Lauderdale. I wrote a paper on the benefits of abortion for my professor, and I didn't realize it, but he was pro-life, and he wrote on my paper, I got an A, he said, excellent arguments, but you're still wrong. So I was debating on the other side of that, and it was because I did not know better. And when I became informed and when I started looking, when I saw a pamphlet of what an aborted fetus, what an aborted baby looked like, and I saw the little baby body parts and the little feet and the little hands, I was like, there's no way. Because we were told that the baby was just a blob. It was like a tissue. It was nothing. You couldn't see it. When I saw the baby, I was shocked, and I began saying, that can't be true. That's a lie. They're lying to me. And so as a young adult, I began educating myself, and I thought, oh my gosh, I have been lied to my whole life. And so anyway, I just wanted you to say it, and that's how I became pro-life. I kind of evolved into this pro-life person, and then I ended up in Florida Right to Life, and I ended up advocating for life, because it's a mission. It's what I believe very, very strongly. And I think the measure of a society is how we protect the most vulnerable, how we protect the people who can't protect themselves. That's the measure of a society. Not that we prey upon the most vulnerable, but that we protect the most vulnerable. Also, I kind of object to you saying that for some people abortion is just not a big deal. They just go and have an abortion and leave and they're fine. I don't think that's true. I think that you might think it's true. I don't think you're a liar. But I've not met a person yet who has, when they finally come to terms with their abortion, they don't tell me things like, I buried this for years. I thought I was fine, and then I started self-harming, or I started drinking, or I started engaging in sexual promiscuity, or I started in drugs. There was always something. And the two women that I discussed this with, one of them was into the self-harm, and the other one was drugs, sex, the whole bit. And so I think that maybe that person hasn't come to terms yet, because it's against the nature of a woman. And so when you said you have a man problem, I'm kind of nodding, because it is against the nature of a woman to allow somebody else to destroy the child that's living within her. That is against our nature. It just is. So, but a man problem, that's an interesting thing to say, because I think what abortion has done very often, it's let a lot of irresponsible men off the hook. And I'm not saying for the men in this room, so don't get mad at me. But a lot of irresponsible men. So many years ago, I was on the University of Miami campus, and this was when we were showing, I had a little TV screen about this big, and I was actually showing abortions. This is an abortion. And then I had, and it was called the Free Speech Zone. You could say anything you want over here. I had a TV. I had the video going of an abortion, and people were walking by saying, that's an abortion, and then we could see the baby body parts. You could see the hands, the feet. It was gross. It was just really gross. The baby's mouth opened up in a scream. I mean, you saw it all. So one of the men, a very handsome guy, walked up to me, and he looked, and he said, oh, just so that you know, we know abortion is wrong. We know that that's a baby. We don't care. I don't care. I don't want the responsibility. And I thanked him for his honesty. He's a very young, handsome Asian guy at University of Miami campus. And I remember saying, do you feel guilty about it at all? He goes, no, I don't. And he said, I don't want that responsibility. So what I feel like, what I know, not in every situation, but in many situations, abortion, and a man telling his girlfriend, or a young man saying, you need to have an abortion because it's available. And she says, but I want an abortion, but I want you to have an abortion because it's available. If it wasn't available, he wouldn't be pushing her into it. Now let's talk about the converse. So abortion has let a lot of very irresponsible men off the hook. There are also men who have an organization that's Expectant Fathers Without Voices is one of them, who have no say-so when it comes to their children. They wanted their babies. They begged their girlfriends, wives, whatever. They begged them, please, please don't do this. I'll take care of the baby. I'll take care of you. They had the abortions anyway. And so they don't have, but if the woman has the baby, she's expected to pay child support, which he should, absolutely should. In fact, I have no problem with starting child support while she's pregnant, while the baby's in the womb. I don't think we need to have the baby born for her to be getting child support. She should be getting child support immediately. But then when the baby is born, when the woman wants to have an abortion, he has no say-so then either. So we have it both ways. So I think it's a multifaceted, there's not like a one-size-fits-all, because we have very good men who really want their babies, and then we have men who are like, I don't care, I don't want this child. I want to just live my life, go to school, go to college, work, whatever. So we have the whole gambit, but we have to realize what we're dealing with in this society, realize what we're doing.
I want to respond really quick again, I'm sorry.
No, please, don't be sorry.
So I want to be clear, because this is like the second time it's accidentally happened. I don't think you're being nefarious. I did not say we have a men problem when it comes to choosing abortion. I said we have a men problem when it comes to abuse. That's what I said.
I didn't say you said that.
Oh, I know. I just want to make sure. I want to be clear because it's going to be recorded, so I wanted to be clear.
I didn't say you said that.
I'm sorry. Okay, you didn't say that. But I just want to be clear to the audience. So with that being said, but since we've gotten here, you know, one thing is that women are not stupid, and people with the capacity of pregnant are not stupid. They can make their own decisions, right, at the end of the day. The second thing to be said is that if a man wants a person or woman to continue their pregnancy, that's a good conversation to have with your partner if you feel like you want to. But that person is not going to miss work. That person is not going to could potentially die. That person's blood pressure is not going to go up. That person's not going to experience the pain of childbirth. That person's not going to have to put their career on hold. That is why it comes down to their decision. Because they have to put up with a lot. They have to make that decision, right? They have to navigate life. Because what I was always told as a young kid is mommy's baby, daddy's maybe. Because after you have that child, people like to walk in or walk out, right? So if someone makes that decision and they're out of wedlock, and we use that term, I'm sorry, I'm not used to hearing that, but that's from the 70s and 80s. My grandma says it too, and I don't mean that in a messed up way. But out of wedlock, right, you have to be prepared to take care of a child on your own, financially, mentally, physically, all those things. I don't know what I would do without my partner and my 2 children. I wouldn't even be here if it wasn't for my partner and being able to take care of my children, right? But I had to make that decision because it was prior to us getting married that I was gonna, if anything, it was gonna come down to I was gonna do it alone because I wanted that pregnancy. I made that decision. That's why I get to show up every day and get to see this feisty 4-year-old that somehow my body got put into her little body, or my mind got put into her little body. I get to be that mom. So I think that that's like a privilege or privileged thought process to think that you get to tell somebody else what to do with their body. And when we think about condoms, birth control, the pull-out method, let's just say what it is, right? None of that is 100%. None of it's 100%. And also saying that some people are upset. I'm gonna tell you, one of my best friends in the world who actually, she's the reason why I became pro-abortion. She doesn't give 2 rats beep, beep, beep about her abortion. She eventually wants to be a mom, but it's not like she cries about it, she cared, any of those things. She made that decision, she knew exactly what she wanted and why she wanted it. Does she want to be a mom eventually? Yeah, for sure, she talks about it. But does she's my closest friend. We've been highs and lows, all of those things. Like, we've had conversations. So we can't make assumptions, just like I'm not gonna make an assumption that some people don't regret it. There are people that regret it. That's just real. But there are people that don't care, and they made the decision that they wanted to, and that's also real.
I think we could continue this discussion.
Well, I would like to say one thing.
Very, very quick, because I want to make sure.
I'll try to make it quick. I'm not good at making things quick, but I'll try. So, talk about women doing what they want to do with their body. That's the autonomy argument. When you're pregnant, it's not your body. It's a baby residing within your body. It's not your body. If you're a female and you're carrying a male, do you have a penis, women? We do not. That baby is living within your body. So it's not your body. It's a child residing within your body. That's that autonomy argument. What is the difference if you're holding that baby in your arms or you're holding that baby within your womb? There's autonomy. This baby depends on me. This baby is 1 day old. That baby can't survive without me. That baby can't eat without me. That baby can't even do anything without me. That's autonomy. Well, if I have autonomy to kill that baby right before the baby's born, why don't I have autonomy to kill that baby after the baby's born? It's not perfect. Because we respect life, that's why. That's that autonomy argument. It falls empty and it falls hollow. By the way, I don't think women are stupid. I are one. And I never said women were stupid, but I do think women should be probably a lot more informed. Thank you.
I think that's because it's called murder.
Oh, by the way, you mean killing? You mean the killing of the
outside
baby?
outside of the utero, if the baby can live without your body, it is called murder.
Well,
That's like outside of your body, the baby can live.
Good argument. Okay, so
Oh, this poor man's
if
going.
that baby, if we're saying that that baby has to be within my body to live, and that now once that baby is born, that's called murder, well, if I go into labor 5 days before my due date, still the same baby if it would have been in 5 days after my due date. Why is it murder after the baby's born, but it's not murder the day before the baby's born? That's that autonomy argument. It makes absolutely no sense. By the way, if that baby's dependent upon me, guess what? My Nana was dependent upon a dialysis machine to live. She was dependent on that machine. She couldn't live without machine. So could they kill her because she was dependent on that machine to live?
People unplug
No.
life support all the time.
That's not the point.
I'm just
That's
saying,
not
we're going to
the
get in trouble,
point.
though.
That's not the point. Also, I want to say, I keep hearing about women dying, women dying, women dying. The maternal mortality death rate in the United States is the current 0.018. Not even 1/2%. 0.018. We keep hearing about women dying, women dying. That is what you need to know.
I could respond, but I'm not going to for the moderation in the panel, so I'm going to hold my Scorpio mouth shut.
Grok it, AI it.
Thank you to both of our panelists. This was maybe the easiest moderation meeting I've ever had.
Just sit there, we'll handle it.
If any of our students have questions, please go ahead and come up to the microphone. I do quickly just have one thing that I want to say, because the theme of this series is civil discourse. And civil discourse, I think, means more than that all viewpoints are welcome, that all viewpoints are expressed, that all viewpoints are respected. I think civil discourse also means finding points of agreement, finding points of compromise. And even I think on this panel with two experts with very, very different views, very, very different perspectives, I think we've seen that there are certain things that we can come together and agree on, that women who are the victims of rape should have the opportunity, if they would like to do so, to terminate that pregnancy. Similarly, with incest, our panelists agree that we should be providing support, information, assistance to pregnant women, to expectant mothers, to young mothers who have recently given birth. And so we have a lot of disagreement, and this is an issue where a lot of people have a lot of very deeply and strongly held beliefs. But when there are points of compromise, there are things that we can work together on, even in issues where there's a lot of disagreement. And so I just wanted to make that point, to thank both of our panelists for sharing their perspectives, and to open things up to our audience for questions if they would like to ask them. Please go ahead and come up.
Hi, good afternoon. My name is Christopher. Don't be fooled. I am a student here, even though I look old. I am old, actually. So just give you a quick background myself real quick. I grew up in a single-family home. My mom raised me pretty much. I grew up in the projects. We were poor, very poor. Of course, didn't let that stop me. So now married for 22 years with 2 girls So things that we're talking about here, I think about very much. And also, I want to let you know, I do work closely with a pregnancy resource center. And my experience with the abortion-minded, basically a lot of them are derived from fear. Capability, because of the lack of capability, financial ability, social stigma, which I can't say if it's valid or not, because you're going to feel how the way you feel. And I think you kind of brought some good points, and I'm glad to hear your points, and I think they're very well laid out because we have to listen. Is that we need to be more apathetic. More sympathetic and empathetic. To what everybody's going through and what they're thinking about. And I always say this too. Like, we have to step up, especially pro-lifers. We have to step up in our compassion and charity. Absolutely. So there's no denying that. So my question is for both of you, and I would like to start with you, Ms. Parker. Like, you give the answer. What are the known effects following an abortion, whether it be the mental and physical for both women and men? And also, I know Planned Parenthood has been brought so many times. I don't know if there's any other places like that. I know about pregnancy resource centers. But does Planned Parenthood provide post-abortive care or counseling? And if they do, or anywhere else, do you know where both men and women can go for post-abortive counseling?
Yeah, thanks. So the first question, can you tell me what your first question was?
Yeah, first question, sorry. What are the known after effects, side effects, symptoms?
So it's both things of what I said and what she said. I'm not going to sit up here and lie like everyone's just joyous. Some people are happy and excited and relieved on both sides, the men and the women. Some people are depressed and upset, and they could go down a rabbit hole, right, of suicide or self-harm. But they could also be forced, if they were forced to have a child, they could also go down suicide, self-harm. It's nuanced. It's not, and I said this before, it's not a one-size-fits-all. And anyone that says like everyone is joyous after pregnancy or after an abortion is not being accurate. Everyone that says, I went through postpartum depression, I have postpartum anxiety disorder. You ever sit in bed and stay up in the middle of the night at 3 o'clock, you're like, my sewing machine's gonna fall on my kid's head, and I have to move my sewing machine out of my closet, and my kids are 4 and 6. So there are mental health issues across the board. I don't work for Planned Parenthood. I want to be very clear. I work for Voices of Florida Fund. I also have fought with Planned Parenthood on a lot of different things. I'm a repro activist through and through. I'm on the ground giving out Plan B, free O-pill, which is over-the-counter birth control, condoms, telling people what the 6-week abortion guide is. And I don't just go to Planned Parenthood. I'm like, here are these other abortion clinics. I'm sure it depends on the location. And if they don't provide anything, they probably should, but again, I'm not a part of the establishment. That's just real. Yeah, okay. I'm just not. I'm an advocacy group.
Did you have any?
Yes, I do. So the abortion industry itself offers nothing for men or women for the after effects of abortion. They do not. The crisis pregnancy centers do. They offer counseling, they offer care. There are many different organizations that offer basically post-abortion counseling, and basically PAS, or post-abortion syndrome, is a real thing. And many women suffer, and I thank you for that question. That's a very thoughtful, caring question. And so, so once the abortion industry gets the money and performs the abortion, that's usually it. And sadly enough, we've talked to women who, when they've had complications, a lot of them from the abortion drugs, when they have to go to the emergency room, are told or advised not to tell them that they had an abortion, or not to tell them that they took the drugs. And that is probably to decrease the amount of percentages of problems, because it's up to 11% for the abortion pills now, which is making up 60% of all abortions now is through the abortion pills. What you do is very valuable, and I want to thank you for that, because we need male counselors. They need male counselors, very, very much so, for the fathers, to encourage the fathers. You made a statement when you came up there. You said most women that come in abortion-minded are fear-driven. That is 100% accurate across the board. What the ramifications of abortions are very often is that immediate feeling of relief, followed by deep, long periods of sadness, anxiety, and then sometimes depression. Sometimes they come out of it quickly. Sometimes the women need counseling, a lot of love, a lot of care, and then many of them feel anger at the decision, and anger at whatever person or whomever compelled them. Many women who have abortions, we need to love them, and we need to offer them compassion. No judgment, just love and compassion. Because the women that I know, and even girls that I know, They didn't have an abortion because it was their choice. They had an abortion because they said they had no other choice, or they were told they had no other choice. One was told, if you want to live in this house, you'll have an abortion. So those compelled abortions even cause more and more grief. So I thank you for your question.
I want to follow up with that. So I think you're referring to the Ethics Public Policy Center. I want to be clear that that study is junk science. It's not peer reviewed, and they have an issue with the data as far as what constitutes as an adverse effect, so that 11%. And I also want to double back and say, like, now actually thinking about it, I know that locally our Planned Parenthood gives out after abortion care packets. For the people, you can also call your doctor and call the hotline after you've had an abortion. There are tons of abortion advocacy groups and abortion funds that you could call, including Tampa Bay Abortion Funds, Florida Access Network, Planned Parenthood, all of those places. If a person that has an abortion, like the actual patient, seeks any kind of help.
I'd like to refute that as well. The ethics in public policy, that is not junk science. It's the exact opposite. What they based the data on was what the insurance company has actually verifiable. These are side effects that were paid out. This is the prior administrations didn't want to record any type of side effects or any type of after effects of the abortion pill, only death. That's the only number they cared about. They weren't documenting hemorrhaging, severe bleeding, severe cramping and pain, doubling over, going to the emergency room. They weren't documenting those. Who was? The industry, the healthcare industry was, the insurance industry was, because they were paying out those claims. They don't want to pay out claims. They want to do the opposite. So if they're paying out claims for all these after effects and all these side effects of the abortion pill, that's documented. That is 100% verifiable, 11%. Thank you.
Given Tylenol.
Okay.
Thank you, sir. We have a number of people wanting to ask questions, so I want to make sure
I just wanna
everyone has
follow
the
up, if I can do
opportunity.
this. So with the, sorry, I apologize. It's because part of the question was the physical. So what are the...
Okay, I'm sorry. I'm afraid we have to move on at this point. And also,
Thank you.
so we can get through all of the questions, maybe we could just have one response from each panelist.
Okay.
Go ahead.
Fair enough.
Mine's only for Miss Bell. I'm going to qualify myself. I'm also an older student. I'm a combat veteran. I'm a Jacksonville native. I went to Bishop Kenny and a registered Republican. I want to combat you on some things that you said.
Go right ahead.
You said that federal law shouldn't be passed dealing with abortion. But it was. Time out.
Go ahead. Go ahead.
Dealing with active duty women. And who did it? Tommy Tuberville. He refused to put forward any more confirmations in the military until zero money was given for abortions in active duty. How do I know this? I was sexually assaulted multiple times throughout my career. The first time, I had an abortion. I'm here to tell you, 12 years later, no ill feelings. Best decision of my life. So when you have people like me who live under federal law, because I also get my health care at the VA solely because I'm a Purple Heart recipient, I don't have to go outside. What do you say for women like me that were assaulted on active duty, have no way to get an abortion because no money is allocated? What shouldn't there be for sexual assault victims in the military that's perpetrated by other service members? And what about the VA? If we give men health care, shouldn't it be equal for both?
Thank you for your question. Thank you for your service. I'm very sorry for what you went through. No woman should ever have to go through that in the military. I hope that you reported the assaults. I hope the perpetrator...
Went all the way to a court-martial and he got a slap on the hand and I got in trouble.
Okay. I'm very sorry to hear all of that.
Yeah.
What you're referring to is federally paid taxpayer subsidized abortion. That's what you're referring to. Not that you couldn't have an abortion, but that the taxpayers don't pay for abortion. That's what you're referring to. There is a law that no taxpayer funds can be used for abortion, with exceptions. Now, I thought the exception was rape. So I would have to do some more. I don't really know. I can't speak too much to what you're referring to. I'd have to do some research on that. So all I would tell you is I'm very sorry for your experience. I'm very, very sorry for what you went through. But we do have a no taxpayer funded abortion, but I thought the exception was for rape. So I will have to look into that.
I'm here to tell you that it's not, because I run an organization of sexual assault survivors who are veterans and active duty. We advocate for ourselves because people like you, ma'am, continually speak against us.
I'm not speaking against you.
Just wait. I let you finish. Let me
No,
finish.
but I'm not speaking against you.
You are out here dictating policy, and you're out here telling young people that stuff that's just factually incorrect.
Like what?
And let me finish, because I'm going to keep it to active duty and military. That's what I'm passionate about, because that's where my fight lies. Right, is for the younger generation of women that don't have to go through what I went through. We're now on our 7th generation of women serving. 7. And within the last year, every policy we fought for since 2020 has disappeared. You can't even report closed anymore. Did you know that? There is no more closed reporting in the military. Either you open report or you don't report at all. It was taken out of the commander's hands and given to a third party to make sure it was fair. Nope, that's been rolled back.
Okay.
Every protection of women in the military regarding abortion and sexual assault has disappeared. Please, please, when you're out here, like doing talks like this, think about us, right? Like, we're out here fighting for this country, and we can't even get the health care that we deserve.
So when you say health care, you're talking about abortion?
Yes, if
Okay.
it's needed.
Okay. So my heart goes out to you, and I'm not going to say it doesn't. It does. And what you went through and what you experienced is inexcusable. So saying abortion, I don't consider abortion health care.
That's your personal opinion.
Abortion is not health care.
It's your personal opinion.
Because abortion, okay. That's
Your
all.
personal opinion.
That's all I'm going to say about
Cool.
that.
Thanks. Look
Thank
into
you.
it.
Thank you. And thank you again for your service.
Yep.
That's hard to follow up.
Can I make one thing clear? I don't like abortion in the cases of rape. I don't like it because that baby didn't do anything wrong. But I know that in the society that we're in, that those exceptions are going to be there. My only exception that I think is really justifiable is that rare case of life of the mother. I do not like abortion in the cases of rape, but I understand the reality, and we have really lost that debate in order to have our 6 weeks bill. That's the exceptions that were in there. But that is the exception that's in law. Yes, and I will defend that. Thank you. Yes, sir.
Well, I would also like to add, just because of what she said, I think that rapists should be punished. I think that rapists should be put to death. That is my personal opinion.
To the fullest extent of the law.
With due process, of course, because false accusations exist.
Yes, with due process, of course. Thank you.
But I just wanted to, I wanted to ask, because several times human rights was mentioned. I just want to ask first if you guys believe in human rights. Would you say you stand up for human rights and believe in human rights?
Yeah, especially in human rights for the unborn as well. Yes.
Human rights, you mean living, breathing, walking, talking humans? Yes, absolutely. My baby that was sitting in my crib, yeah, my baby has rights, for sure. I mean, I'm going to go ahead and say I reject the premise of this question, but go ahead.
Human rights for the unborn as well, yes.
I'm not surprised. So we need to first define human, right? Well, I feel like that's pretty easy. And
Not for a lot of people.
scientifically, a human is very easy to distinguish and easy to tell, especially when their life begins. I believe all humans' life start at conception, because that is when new DNA is created. When new DNA is created, when the sperm and the egg combine,
DNA.
that is when you have a new life. And I believe that is a human. And to say you believe in human rights and that humans, even at the initial stage of development, don't deserve human rights and life, liberty, and pursuit of happiness as well, goes against the Constitution.
Yeah, so I want to say that why human rights it's not as easy to find. If we look at the United States of America right now, our neighbors are being deported by ICE and kidnapped off the street. Do they have human rights? Or how about the children in Palestine that are being bombed? Do they have human rights? What are human rights when it comes to the United
That's
States of
changing the
America?
So that's a red herring.
Changing the subject.
Yeah, that's a red herring. That's a
No, but I'm
lot
saying you said
fallacy.
human rights, so I'm asking you what you said.
Yeah, they're illegal immigrants and people of a different country.
Are they human? Yes or no? Yes, are they human?
We're not killing them.
Humans are humans. Yes.
Humans are humans, so humans should have human rights.
When is a human a human?
When is a human a human? You just said
At conception. At
conception.
conception, a human is a human.
So what you're
And what
telling
you're
me is
doing
that-
is you're trying to define a person as something that is not a human to justify abortion. Now, I don't want to just attack you.
Okay.
Because you have also said that you agree with abortion in certain cases, and I would
Life of the
completely
mother.
disagree,
Life of
which
the
I
mother.
would argue is not anywhere near a significant amount to advocate for it.
I just gave the data on that, how low it is, the life of the mother, what a small, minuscule
And
amount. of the
I would
total.
even venture to argue that that's inflated because there's millions and millions of people in this country. Now,
Fair, that's fair.
I also want to point out that when we decide when a person becomes a human, borders on the abolitionists, what the abolitionists of the past stood up for. I consider myself an abolitionist of abortion.
I just see your shirt.
And what the abolitionists of the past stood up for was the abolition of the slave trade and slavery, because slaves were treated as not human. They said, oh, that's not a person. So that is the same rhetoric and the same logic that was used by people that supported the slave trade and slavery.
Yeah, can I respond now? Are you going to cut me off or are you going to let me respond? Because I let you respond, I let her respond, I'm going to respond.
I mean, I wasn't finished, but I will let you
I
speak.
raised my hand, you nudged, so if
Yeah,
you would
no,
like to
you can
continue.
go ahead,
can.
go ahead.
Okay, so you told me what I was doing was a red herring, but then you talked about abolitionists and slavery. Is that not a red herring? When you're saying what is human rights, I say that it's hard for people to define that within the United States of America because it's ever changing. Just like abortion policies, just like housing policies, everything is ever changing. Everything that we're seeing that was what we believed in the last 40 plus years has been changing, right? So we look at human rights, we talk about abolitionists and slavery. What about the prison industrial system? Should they be treated the way that they are? Is that not slavery? They're getting paid below minimum wage.
Oh, my God.
I would argue that that's another.
Okay, thank you for your
red herring.
question, sir. I think you've made your point, and we have many more people standing behind you. Thank you.
I thank you, by the way, I thank you for your question, and thank you for being so transparent.
So my question is actually along similar lines to his, but in particular, I'm actually really glad that he went first so that I can have it a little narrowed in scope. But if we agree that all humans deserve human rights, and we agree that the unborn are humans, then just because in certain situations in society we abuse human rights, does that give us the liberty to abuse the human rights of other humans?
Does not.
I did not say that an embryo was a human. Those words never came out of my mouth.
So
Then
can I answer
what-
that?
Yes, ma'am.
So biologically and genetically, basic biology, go to third grade biology, that's a life at conception. And you have DNA intact, you have DNA in place. So that is not potential life, that's life. It's amazing because we see water on a planet and we call it life. But you have a baby with perfect DNA. All that baby needs is time to grow in his or her mother's womb. That's all. That baby is a human. That baby should have all of the rights. Now, I've said the only case that I am very comfortable with would be that life of the mother, which is rare. And I agree with that, especially if you're talking about 20 or 24 weeks and a woman has a crisis, they can actually do a very quick C-section and deliver that child and save that child's life and the mother's life. And that C-section is much safer than the late-term abortion. That late-term abortion is so horrendous on that female's body. It does a lot of basically physical damage. But your question is correct. That baby is a human from inception.
Quick question, Ms. Parker, because you said you do not agree that the embryo is, did you say a human person or a human life?
What are you asking? I'm sorry.
I'm asking a clarifying question before I get to the other question to make sure I phrase it right.
An embryo is an embryo. It is a bunch of cells. That's what I feel. And if I feel like that, if we have to, it comes down to the person choosing autonomy. That's where I lie. It's a pregnancy.
Yes.
If it cannot live outside of the womb of its keeper, it should not have the same rights as my child does that's 4 years old, no. Or even a 1 month old, or even if you know anything about NICUs, there's called an adjusted age. So technically you can have a baby at 30 weeks and they could be 28 or 32 weeks adjusted. So if that baby can live and survive outside, be it in an incubator or whatever, then so be it. But that's just where I stand. And the whole thing is that there's Jewish people that do not believe the same way I believe. There are Christians that do not believe the way that I believe. And that's the beautiful thing about America is we're allowed to have all these different beliefs.
Yeah, but there's a saying, I like to say this. There's an adage that says, I have a right to throw a punch, but my right to throw a punch ends where your nose begins. And that's the same way we need to talk about our unborn babies. So to say that that baby has no rights, no inherent rights because of its occupation, because of where that baby is living. When we talk about occupying, let's talk about occupying the womb. That baby is occupying the womb. That baby has all rights and that baby has every right to life and every right to live because that baby is human.
That kind of reminds me of what I was saying earlier about jurisdictional fairness.
Yeah.
I don't have anything else. I don't want to keep up. There's 5 people behind you, but.
Mr. Nick, do I have an opportunity to ask the question that was going to follow my clarifying question, or would you like me to move on due to the people behind me?
I think we should probably move on at this point.
Okay. Well, thank you both for your time.
Come get that. It's for our event in Jacksonville.
I'm actually well aware of it. Yes, ma'am.
Hello, I'm a little nervous, sorry to have this year. My name is Alexa, I am a student at UNF. Personally, I wouldn't choose abortion for myself, but I believe that, everyone has a right to decide their own reproductive journey and, make that decision for themselves. I don't think anyone should make that choice. I just have one question. So obviously we covered that Florida has a 6-week period. Do you guys think that 6 weeks is enough time for a woman to decide? It just seems too early.
No, I do not think that because a lot of people have very irregular periods. I'm one of those people. I happen to be very in tune with my body, so I knew something was wrong when I didn't when I got pregnant. I was there's something wrong. Take me to the hospital. Take me to somewhere, right? Because I was supposed to have kids. So no, absolutely not. And I think that actually pushes people to have abortions, right? Because they don't actually have the time to sit and think about it. It's how can I do this? How can I plan my life out? How can I chart my life out? And it probably pushes them to places like PlanCpills.org versus probably going to a Planned Parenthood and sitting with a clinician. So absolutely not. I think that people should be able to take their time to make a decision that's going to change the path of their life and make a decision that's best for them and their families.
So I'd like to go back to first your premise about you personally would not have an abortion, but then you don't want to tell somebody else what to do with their body. So that argument, with all due respect, that argument says, I don't want to do something or perpetuate that upon my child, but if somebody else does, it's okay. It's really not. And so what we're saying is, as a society, so if I would never abuse my child, I'm just saying I would never abuse my child, but if you want to abuse your child, that's okay, because that's your personal autonomy. I would never do this, but if you want to do it, that's okay. That's the argument. That's the argument as a whole. We're saying that it is okay. If you think something is wrong, if you think something is morally wrong, then it's morally wrong, period. It's not okay for somebody else to do.
Excuse me, ma'am.
Do you want to go? I want to reject that because I have never had an abortion. And I would not choose an abortion at this moment in time unless it was to save my life because of my family. But I want to reject that completely because it's telling me that my friend that is vegan, because she's vegan because of health reasons, that it's morally wrong for me to eat meat. Now, some vegetarian and vegans feel that way.
Are you equating? Wait a minute.
Am I equating?
Wait a minute.
I'm equating cultural things.
No, we're equating taking the life of an unborn child with being a vegan.
I mean, you're taking the life of a life.
I'm sorry, you said it. You said it. It's a very poor analogy.
Okay.
I'm just going to say that.
I'm not.
So what I'm saying is, do I think the 6-week ban gives people enough time? Yes, plenty.
Excuse me. My decision not to get an abortion is my choice.
Mm-hmm.
I'm from a Christian household. I'm still a Christian, and it's my beliefs. However, everyone has a different belief system. Everyone has the right to choose. Everyone has a different background. And of course, I have no right, and I believe that no one has a right to, force their beliefs on anyone or tell them what they should do. I don't know a woman's story. I don't know what they're going through.
So you said you're a Christian. That's awesome. So when the Bible says, behold, I knew you. I formed you in the womb. I created your innermost being. I knit you together. You are fearfully and wonderfully made. As a Christian, when you say you are a Christian, that means you represent that ideology and that theology of how wonderful and precious that baby is. So then as a Christian, you should be there fighting to defend that life that God said is precious.
Yeah, the Bible also says that you shouldn't get tattoos, and yet a lot of Christians even still get tattoos. A lot of people say you shouldn't be gay, but still.
Okay.
A lot of gay Christians.
I'm not going to conflate issues. I'm not going to do all these red herrings. The issue at hand that we're referring to, it's really wonderful to go off on all these rabbit trails and to make improper comparisons. But what we're talking about here is a human life. We're not talking about a mark on our body. Now, by the way, that's also been possibly misconstrued as a mark on the body being referred to as a tattoo. Don't really know for sure. So the bottom line is we're referring to, when you said you were a Christian, I just thought it would open the door up to say this is what Scripture says about the unborn children.
And Scripture, they also murdered a
Thank you. Thank you very much.
Hi, I have a couple questions for Ms. Bell. Number one, you said that abortion lets men off the hook.
Often.
This implies that having the baby will make that man stay and provide for the baby and the woman, and that is just completely unrealistic.
Okay, so I wasn't referring to staying. I was referring to taking responsibility. And by law, that father of that baby must take responsibility, whether he wants to or not.
By paying child support, by paying a few dollars a month?
No, it's not a few dollars a month, but what I'm saying is very often, so there are multiple cases where a man gets somebody pregnant and he does not want the responsibility of that child. So very often, and I even know circumstances where the man who did not want the responsibility ended up becoming a very good father. So you just don't know what's going to happen. But yes, abortion does let a lot of irresponsible men off the hook. I stand by that because it does. It just lets them off to go off and impregnate somebody else and tell them to get an abortion. So when you hold that man accountable and responsible, then he is on the hook to pay child support, and he should. He should absolutely pay child support for the rest of that, at least until that child's in college, or until that child's 18.
Yeah. You said that it lets them off the hook to go off and impregnate other women and force them to have abortions. A man who was paying...
I never said force.
What did you say? You said something about make them have abortions or something?
No, what I'm telling you is, just like I said earlier, a lot of men or boys who get girls pregnant, get women pregnant, say, I don't want this baby, go get an abortion. Here's your, whatever it costs these days, $700, $800. Here's your money, go have an abortion. It lets them off the hook. I mean, I don't know what's so complicated about that. It lets them off the hook. They don't have to pay child support for that child. So we're allowing a lot of men, and there are, by the way, there are really good men out there who want their children as well, who want their babies. And so you have the converse, and they're not giving a choice either. So what I'm saying is there are men who do not want the responsibility of having a child, like that college student at University of Miami. He was very clear about that. He said, I know it's a baby, I don't care. I don't want the responsibility. I want to have my fun, but I don't want the responsibility. So when I say abortion does let men off the hook, absolutely, that don't want to have the baby.
Okay. Number two, you said the maternal mortality rate in the United States is 0.01%.
No, 0.018.
0.18?
Yeah.
Okay, so even more. If it was 0.01%, that is 34,000 people.
You're talking about in the whole entire United States of America per 100,000 births.
Okay, it's still thousands of people. Even if an abortion saved one woman's life, out of that thousands,
that's my point.
That is 100% worth it.
I'm glad you brought that up. So what we're saying is 98% You're saying that 98% of all abortions should be legal, just in case 1% or 2%.
I'm saying 100% should be legal.
They can. They can.
Oh yeah, they are. They are in the state that I'm from. We actually wrote it into our constitution, and I think that's
What I'm
great.
telling you is they can. If life of the mother, if their life is at risk, they can have an abortion in the
But
state
then
of
what do
Florida.
you say about the cases that she mentioned, like that woman in Georgia?
We are using what my point was, and I will reiterate my point, is that the extremist arguments are always used to justify the killing of unborn babies. The extremist arguments that don't apply to 98% of
But it
babies
still
being
matters,
born.
even if it's one person, because that's
Every
a terrible,
life
terrible
matters.
thing to happen to them.
Every life matters.
Exactly,
Every
and a
child
baby
matters.
inside of you is not alive.
Linda.
Wait, 1 second. Did you say the baby inside of you is not alive?
Yeah, most of the time it cannot survive outside the womb.
That doesn't make it not alive.
To abort it.
That doesn't make it not alive.
Then you wouldn't have to take a kid first.
Wait. Let me make something very clear. Genetically, biology, my little granddaughter can look at a fetal model and say, look at the baby when that baby is 12 weeks gestation. I should have brought my models with me. I wish I would have. So the
I
fetal
just don't
models.
believe, like she said, that it should have the same rights as like a 4-year-old
This
child.
is a catch-all. This is like what happens is it's like they hyper-focus on, oh, is that a life? I've got you one.
Yeah.
Oh, how the Christianity, I got you. Instead of like actually dissecting it, yeah, I have not the greatest analogies, but also you all have the same arguments since the 70s too. With that, I wanted to ask, because you actually made me think
Because
about
life
that.
hasn't changed since
she
the
wants to ask me a
70s.
question.
Biology hasn't changed since the
I wanted to
70s.
ask, well, I mean, there's a lot of stuff that's changed in the 70s, which is why I wanted to
Biology
ask-
hasn't. It's still a
Which
baby.
is why I wanted to, well, at that point in time, they were just getting over the fact that black women felt pain less or more than the average white person. So
Good,
I
keep changing
digress.
the subject. That's great.
I digress. The maternal mortality rate is from 2020 something, right? That's with abortion bans being in place. I don't know the answer to this, but prior to 1973, I wonder what the maternal, I really don't have a answer to this, so maybe I'm giving you a hell of a
I'll get you the data. I'll get you the data.
Prior to 1973, what the maternal mortality rate is.
But you're saying that maternal mortality rate means the more abortions you have, the more women live?
Yeah.
No.
Wait, maternal mortality, say that again?
You're saying
Maternal mortality-
abortions and having abortion legal helps keep more women from dying? Because women who have
I'm a living thing.
women who have
No birth certificate.
endangered pregnancy, life of the mother, can have an abortion everywhere in every state. So I don't know what you're talking about.
That's inflation. A maternal mortality
No.
rate is people
In
that...
La La Land, that would be true. But because it is so hard to prove those things sometimes, people are dying because they cannot get it approved fast enough.
Here we go
Yes.
again. It happens. I didn't say it didn't happen. I'm not denying it. But what you're doing is exactly what the left always does.
So now
They're
we're
saying
bringing
that-
left and right into it, which is just,
Well, it's just a fact. I mean,
How do you know I'm a Democrat?
let me
How do you know I'm
rephrase
on the
that.
left?
The pro-abortion
I
versus
might be
the
conservative.
Okay, the
I feel like we're
pro-abortion.
going around in circles.
Okay, the pro-aborts versus the pro-lifers. The pro-aborts always use the most extreme.
you did the same thing. Like, oh, she was forced to have an abortion. She committed suicide after.
Yes, she did.
That's
Yes, she
another
did.
one person.
Well, so much for her choice, right?
Yeah. So the person who forced her should be in jail, yes.
That person who forced her is being multiply sued for millions, yes.
Yes.
Should be.
in
I agree.
jail.
I agree
Yes.
with that. I agree with
About
that.
the rapists and people that...
They should be in-
They should be in prison and jail. I think we can agree on that. I think we're...
Oh, I think we 100%. Well, I'm good. We're good. I just think that we
here.
cannot make policy. We cannot make policy to kill all babies because of the rare incidences where a woman's life is at risk when she is able and available to have an abortion.
Right. Thank you for your question.
Oh, I had one more question, actually. So let's face the fact that if abortions are banned, abortions are always going to happen. Okay?
Okay.
They're just going to be unsafe at home, like things that happened, like in the 70s. They're always going to happen, but
So you
they're
talk
going
about
to be
the
unsafe.
So you talk about unsafe.
Yes.
So
if they're not
do you
done by
think
a provider, like a clinician.
that's a false argument. That's also a very, very false argument, that as abortions increase, the problems increase with abortions. The side effects of abortions increase, not decrease. And not only that, in the 1970s, the so-called, if you go look up Bernard Nathanson, who was a prolific abortionist, who said we absolutely lied, we doctored the data, we lied about the death numbers in order to have, to force abortion to become legalized. He ended up becoming a very, very pro-life doctor after revealing what they did to lie about abortion. There's multiple books out there, you should look them up. What happened with abortion facilities is they went from back alley to front store.
You know,
Yes, with licensed providers.
I want to say that I got.
You're saying an abortion that's like a DNC is the same as using a coat hanger?
See, that's also very rare. Go do some research on it.
Well, I've done my research, actually. You do your research from Fox News.
Okay, so with that being said, I think everyone needs to do dramatic breathing. No, because I want to speak. You got to speak for a whole second.
You don't know me.
I don't think any of this is like conducive to what we're all trying to do.
You think?
But also, you've gotten to speak a lot, and I've let you have a lot of airtime, so I would like to respond to that. I actually got to sit with Heather Booth, who was part of the Jane Network. I got to sit with her for about 2 hours. Absolutely amazing advocate. I do not know about the person that said that they skewed numbers. Men often tend to lie. But I do know I got to hear about the horrible stories that were happening prior to that and prior to the Jane Network and all the amazing work they got to do, even though they risked themselves having felonies and such. I think that it's really important to know everything that you're saying is accurate. And people like me and her get prepped, and we have conversations like this on a regular basis, and you're handling yourself really well. I think it's important for all of you to take this misinformation and disinformation, take it home, tell people about places they can get more information, like plantcpills.org. Have conversations. We can dissect every day what human life is or what's not human life, what the laws say or what the laws are, what's not. But you know what we can do? We can sit down and have these conversations like we're having right now and bring factual, real information so that people like you can make a decision. And that is important. That is what the American dream is about, and that is what America is about, is us sitting down and having these hard conversations.
Thank you.
Yeah, I completely agree.
Thank you.
I am very sorry, but we are completely out of time and we cannot go past 3 o'clock because this room has to be broken down and prepared for another.
I'm here if you want to ask questions.
Our panelists have been very generous with their time, and perhaps they could answer our remaining 2 students' questions individually.
If you want to ask.
Thank you all for coming. This was a robust debate, and I think we have not solved this issue, but at least have provided some interesting perspectives. Thank you.
And